Have you ever wondered if your body is trying to send you a message? Sometimes, the signs are quiet, almost invisible, yet they can mean something important. Today, we are going to explore a topic that affects millions of people worldwide: diabetes. Before we dive in, take a moment to support this channel by liking this video and subscribing. That way, you'll never miss out on valuable health insights that could make a real difference in your life. Introduction: Why awareness matters. Could someone actually be living with diabetes without even knowing it? The truth is, yes, it happens more often than many expect. This condition can develop silently, with signs so subtle that they are often overlooked or confused with everyday issues. That's why awareness is so important. Recognizing early warning signals and paying attention to changes in your body can encourage timely medical checkups and professional advice. In this video, we will walk through 20 possible signs that may indicate diabetes. Some of them are common, some are surprising, and one of them, especially number 18, is often overlooked. What is diabetes? Diabetes is a chronic condition that develops when the body cannot properly regulate blood sugar levels. Normally, the pancreas produces insulin, a hormone that helps move glucose from the blood into the cells, where it can be used for energy. In type 1 diabetes, the immune system attacks and destroys the insulin-producing cells in the pancreas. In type 2 diabetes, the body either does not use insulin effectively or does not produce enough of it. This type is often associated with being overweight, having a sedentary lifestyle, or genetic predisposition. When blood sugar levels are not regulated, it can affect blood vessels and many other systems of the body. That is why noticing possible warning signs is so crucial. 10 possible signs you should not ignore. 1. Unusual thirst. Feeling thirsty all the time, even when drinking enough water, may be a sign that your body is struggling to balance fluid levels. High sugar in the blood can lead to more fluid loss, and that loss can make you want to drink constantly. Persistent unexplained thirst should always be discussed with a healthcare professional. 2. Frequent urination. Needing to urinate very often, especially during the night, can be linked to high blood sugar. When excess glucose circulates in the blood, the kidneys work harder to filter and remove it through urine. This can lead to more frequent trips to the bathroom and may disturb your sleep. Ongoing or unusual patterns are worth medical attention. 3. Excessive hunger. Sometimes, the body signals hunger even after eating a full meal. This may happen when cells are not able to properly use glucose for energy. Despite food intake, the body still feels like it is lacking energy, leading to constant hunger. Over time, this may contribute to weight gain, especially if high-calorie foods are used to satisfy the cravings. 4. Unexplained weight loss. For some people, the opposite happens: they may lose weight without changing diet or exercise routines. This can occur when the body is not absorbing nutrients effectively. Even though calories are being consumed, the body may not be able to use them properly, leading to unintentional weight loss. If this happens repeatedly or significantly, it's important to seek medical advice. 5. Persistent fatigue. Feeling unusually tired, even after a full night's sleep, can be a sign that the body's cells are not receiving enough energy from glucose. Fluctuations in blood sugar can leave people feeling drained, weak, or less able to concentrate. Unlike everyday tiredness from stress or late nights, this fatigue tends to be more persistent. 6. Blurred vision. High blood sugar levels can affect the lenses of the eyes, causing swelling and difficulty focusing. This may lead to temporary blurry vision, which can sometimes be overlooked. But if visual disturbances appear often, it's important to take them seriously and talk to a professional. 7. Slow healing of wounds. When the body takes longer than usual to heal from cuts, bruises, or small injuries, it can be a signal worth noticing. Elevated blood sugar may interfere with the body's natural healing processes, making it harder for wounds to close and recover quickly. 8. Frequent infections. People experiencing blood sugar imbalance may find themselves more prone to skin issues, gum infections, or urinary tract infections. This happens because the body's natural defense system can be affected when glucose levels are not stable. 9. Gum problems. Red, swollen, or bleeding gums can sometimes be linked with underlying blood sugar issues. Good oral hygiene is always essential, but if gum problems occur repeatedly or do not improve, it's important to get them checked by a dentist or healthcare provider. 10. Nausea and vomiting. Nausea and occasional vomiting can have many causes, from food intolerances to infections. But when these symptoms occur repeatedly, especially in combination with thirst, fatigue, or frequent urination, it may be a sign of an imbalance in the body's sugar regulation. 11. Frequent headaches. Headaches can appear for many reasons, but in the context of blood sugar imbalance, they may occur more often. When blood sugar drops too low, dizziness, confusion, or headaches can follow. On the other hand, consistently high sugar levels may also affect blood vessels, sometimes leading to pressure in the head. If headaches are persistent and unusual for you, it is wise to seek professional advice. 12. Frequent infections. Recurring infections, especially urinary tract infections or skin infections, can sometimes be connected with high blood sugar levels. When the body's natural defenses are challenged, bacteria and fungi may multiply more easily. Paying attention to repeated infections is important and should always be checked by a healthcare professional. 13. Mouth infections. High sugar levels can also influence the oral environment. Some people notice frequent gum infections, swollen gums, or even tooth issues. Sugar in the saliva can encourage bacteria, which may affect oral health. Regular dental hygiene, brushing, flossing, and dental checkups is a simple but powerful preventive step. 14. Inflamed gums. Red, irritated, or bleeding gums, especially when brushing or flossing, can be an additional sign worth noticing. Even though gum irritation may come from other causes, in some people it can be connected with underlying blood sugar issues. Good dental care and professional guidance are important here. 15. Dry skin and itching. Dry skin, itching, or recurring rashes may sometimes be related to changes in circulation or skin health when the body struggles with sugar balance. While dry skin can have many causes such as weather or skin care habits, ongoing dryness or skin irritation deserves attention. 16. Tingling or numbness in hands and feet. Tingling, burning sensations, or numbness in the extremities are possible signs of nerve involvement. The nerves in the feet and hands can be especially sensitive to changes in blood sugar. Over time, this can affect daily comfort and mobility. 17. Digestive changes and bowel issues. Some people experience digestive challenges such as bloating, diarrhea, or changes in bowel movements. Nerve-related issues can also affect digestion and bladder function. Since many factors may cause these symptoms, it is important not to ignore them if they persist. 18. Concentration problems. This is one of the most surprising and often overlooked signs. Difficulty concentrating, memory lapses, or sudden confusion can sometimes be connected with fluctuations in blood sugar. Both high and low levels may affect brain function, leading to trouble focusing or maintaining mental clarity. 19. Increased abdominal fat. In type 2 diabetes, insulin resistance can lead to the body storing more fat around the belly. While weight changes can be caused by many factors, central fat accumulation is considered a relevant risk factor for metabolic problems. 20. Constant tiredness and low energy. Living with ongoing low energy that does not improve with rest is another possible signal. The body may not be using energy from glucose effectively, leading to a feeling of constant weakness or exhaustion. Unlike normal tiredness, this type of fatigue can deeply affect daily life and motivation. Risk factors to be aware of. Some conditions and habits may increase the risk of developing diabetes or related complications. Excess weight or obesity. Sedentary lifestyle. High sugar or refined carbohydrate intake. Long-term alcohol consumption. Certain medications such as antibiotics or diuretics. High triglyceride levels. Genetic predisposition and family history. Viral infections or autoimmune conditions. While not every factor can be changed, many lifestyle choices are within your control. Prevention and healthy habits for pancreas and blood sugar support. Taking care of your body every day can support your pancreas and help maintain stable blood sugar balance. Here are some helpful steps. Eat more fiber-rich foods, whole grains, legumes, oats, beans, and vegetables that keep digestion regular and support gut flora. Choose probiotic foods, natural yogurt with live cultures, kefir, sauerkraut, kimchi, or other fermented foods may help support a balanced gut microbiome. Include prebiotic foods, bananas, garlic, onions, and asparagus provide nourishment for healthy gut bacteria. Add healthy fats. Fatty fish like salmon, mackerel, and sardines supply omega-3 fatty acids that may support overall well-being. Eat colorful fruits. Berries, apples, and citrus fruits bring natural antioxidants, vitamins, and minerals that support metabolic balance. Stay active. Regular movement, even walking, helps the body manage energy more effectively. Stay hydrated. Water supports healthy metabolism and digestion. Avoid smoking and limit alcohol to reduce stress on the body. Manage stress. Relaxation, meditation, and mindful breathing support balance in body and mind. Maintain a stable weight with a consistent, balanced lifestyle. Though the pancreas is small, its role is enormous. And when it begins to falter, the body often whispers before it shouts, through small shifts in digestion, energy, or how you feel overall. Recognizing those whispers can be just as important as noticing the louder alarms. Alongside these possible signals, paying attention to risk factors, and building healthy habits like a fiber-rich diet, probiotic and prebiotic foods, regular exercise, hydration, and balanced living, can support long-term health. Remember, the most important step is awareness. Noticing changes early and consulting a qualified healthcare professional is key. And please notice, this video is for informational purposes only and does not replace a personal consultation, examination, or diagnosis by a licensed and qualified physician. In particular, for any questions regarding medications, always consult your doctor and follow the instructions in the package leaflet. The information provided cannot and must not be used for making independent diagnoses. Liability is excluded. Your health is one of your greatest treasures. Listening to your body and taking small preventive steps can make a meaningful difference in your well-being. Share this video with others to spread awareness. You never know who might benefit from this knowledge. And if you enjoyed this video, feel free to give it a like and subscribe to my channel so you won't miss anything in the future. Thank you.